Hi guys, my name is Dr. Mona Hardas. I'm a board certified OBGYN, a cosmetic gynecologist, a minimally invasive surgeon, an author, as well as a social media educator. Today, I wanted to talk to you about low sexual drive, low libido, or also called as hypoactive sexual desire disorder. Now, long name, but very common condition. Believe it or not, 43% women sometimes in their life will suffer with low libido. Can you believe it? 43%. Yes. So you're not the only one. There are a lot of women out there. So please, if you have these symptoms, please talk to your gynecologist and try and get help. Now, why does this happen, right? That's what I wanted to talk to you about. What are the causes? And there are multiple causes, it's not one thing. Now, sexual desire or libido is different for different people. Some people have low libido their entire life, they're fine with it, nothing bothers them. So they don't need any treatment because that's their baseline. But there are women who had a normal libido, normal for them, and all of a sudden they find out there's decreased desire, and then that causes distress. It can cause distress in themselves, distress in their relationship, and those are the women who need treatment. So how many? I would say about 10 to 12% of all women who have low libido, it's that low that they are under distress. So, what is low libido? Low libido means you have decreased desire for sex. You have decreased, you don't initiate it. If there are sexual advances, you really don't respond to it. You don't respond and you don't participate as much in it. Sometimes you participate because you have to, you think it's your duty, and you want to keep your relationship going. You have decreased fantasies, decreased sexual thoughts. All this combined into this hypoactive sexual desire. Now, there are different reasons why this happens. Commonest is psychological. Stress of some kind, stress in relationship, work, studies, whatever, that we can bring that stress home and it can lead to this. So there are other causes as well, but psychological is common. And I'm telling you, as a woman, our body goes through so much, doesn't it? It goes through so many stressful events in our life. To start with, pregnancy, right? Pregnancy and childbirth. Now, as we get pregnant, our body image changes. We ourselves don't perceive sometimes as beautiful. So that change in a body image, also the fatigue, the nausea, vomiting, tiredness, aches and pains in the body. The last thing is in your mind is having sex. You want to rest, you want to take it easy. So you're not thinking about it. So the desire physiologically goes down. Sometimes some women also have this fear of harming the baby inside and guilt about self-pleasure. And those are the women who would shy away from having sex or will not showing trust or not respond to it. Well, what about after delivery? Again, there are certain reasons. You're tired, right? You have sleepless nights, you're breastfeeding. Again, decreased desire is common at that time. If you had a C-section or you had episiotomy, well, the sex can be painful a little bit, and that can also decrease your desire for sex. Breastfeeding will decrease your estrogen level. Now, estrogen in our body is really important. Estrogen increases sensitivity, it increases lubrication, it makes the lining of the vagina thick enough and sensitive enough, plus estrogen increases desire. Now, decreased estrogen during breastfeeding can decrease sexual desire. So that could be a part of postpartum decreased sex drive or decreased libido. Postpartum blues or postpartum depression is another thing, right? How can you, if you're not feeling good, you're not feeling good about the situation, about you, how can you be interested in sex? So those are physiological reasons. Another stressful time in our life is perimenopause and menopause. At that time, again, the estrogen levels, the testosterone levels decrease in our body, causing tighter vagina, right? The neck caliber of the vagina, the opening gets smaller, tighter, so it's painful. There's decreased estrogen causes decreased lubrication. So not only the desire is decreased because of that, but also the pain decreases it. So these are the stressful events in our life. But again, I told you, work, relationship problem, all those psychological thing can decrease desire. Now depression is common. Depression and anxiety has a very interesting relationship with low sexual drive. Depression can cause low sexual drive, and low sexual drive or low libido can cause depression. So it's like a vicious circle. And why does this happen? It happens because of there are a couple hormones in your brain. One is called dopamine and another is called serotonin, and they play a huge part in our desires and our wants. Now when dopamine level is high, we have desires, we have a great libido. Decreasing dopamine and increasing serotonin changes this balance and the sex drive decreases. So depression can do that, can decrease dopamine, increase serotonin, and there are certain medications which can also do that. They will change this balance and will lead to low libido. There are certain we call SSRI or serotonin intake inhibitors which can do that. So it's important for your doctor to know what medications, if you're on depression, what medications you're on, so they can adjust it and help you with your symptoms as well. Certain past experiences, past painful experiences, painful sex, sexual abuse, rape, all these things will have the negative impact and it will decrease your sexual desire as well. There are certain chronic medical illnesses like diabetes, high blood pressure, seizure disorder. Also, I mentioned depression earlier. Those conditions, along with chronic pain. If you're in pain, that's the last thing on your mind is to have sex, right? So all these conditions and certain medications which are used to treat this condition can decrease sexual desire. Now there are certain physical things which can decrease sexual drive. Like there's a condition called vaginismus, and I have a video on vaginismus. If you want to go and watch it, if you want to know more about it. But in vaginismus, what happens is that there's an involuntary contraction of the vaginal muscles, making it really tight and painful during sex and during penetration. So that can cause pain, and you will not be interested in having sex. Certain chronic vaginal infection or increased sensitivity to some substances causing vaginal irritation and pain, again will make sex painful and will decrease the desire. Sometimes there is we call a septum in the vagina. It's a thick band of tissue which will make penetration painful. Sometimes a person may have a very tight hymen or a hymenal ring, which will also make the penetration painful. So those are the vaginal conditions which can cause pain and decrease the desire. Sometimes a patient or a woman would have, say, fibroid tumors or ovarian cyst or an endometriosis that will cause pain at deep penetration. and will make sex painful, and obviously the person will not be interested. Prolapse of the uterus is another condition. When the uterus prolapses, is kind of into the vaginal canal lower down. So during sex, it's like a hindrance, something in the canal which is causing pain and discomfort. So there are so many different conditions which can cause pain, leading to decreased sexual desire. So you see, there are so many different reasons for decreased libido. So it's really important to find out what is the cause of your decreased libido. So please see your gynecologist. They will do a thorough history and a physical exam, and they will try and help you out with the treatments. And there are lots of treatment options. There's a lot of information about it, so I decided to do another video on the treatment. So please watch my next treatment, and we will talk about what can be done to help you with your low sex drive.